Hi, Assalamualaikum warahmatullahi wabarakatuh. My group and I from Group 4 will be presenting on philosophical reflections on mental health issues, understanding depression among students. For the first part is the introduction, to which philosophy offers unique insights into student depressions by examining existential concerns like self-meaning and also purpose. Integrating philosophical perspective with psychological support enhance the understanding and also the approach to this issue, fostering a more supportive educational environment. On the next part of this infographic is dermatology, to which prominent existential philosophers like Soren Kierkegaard and Friedrich Nietzsche address themes of hopelessness, the meaningless of life, to which human predicament offering value perspective towards the depressive experiences. Psychologists such as Viktor Frankl highlights the significance of finding meaning in suffering, such as basic human endeavor. A mixed approaches research strategy combining qualitative and quantitative methods is necessary in investigating of students' experience with a depression and also the element traits that leads to its development and persistence.
In this poster, we pointed out for 3 literature review. In the first literature review is a deeper understanding of depression and suicidality among medical students by Noah Hyman et al. 2018. This study explores the prevalence and contributing factors of depression and suicidality among medical students. It highlights the unique stressors faced by this group, including academic pressure, workload, and the emotional toll of medical training. And the second literature review is structural model of suicidal thought based on parenting style with the mediating role of anxiety and depression in students by Muhammad Sadiq Dervishi et al. 2023. Dervishi and colleague examined the relationship between parenting style and suicidal thought in students with a focus on how anxiety and depression mediate this relationship. And the third literature review is determinant of anxiety and depression among university students of Lahore by Hamid Said et al. 2017. Said and his team investigate the determinants of anxiety and depression among university students in Lahore. The study identifies several key factors contributing to this mental health issue, including academic stress, financial difficulties, and lack of social support.
We continue with results. Based on both Stancy in 2005 and Owens in 2012, they have said that consistently demonstrate a negative correlation where higher levels of depression translate to poorer academic performance. Besides, we have also researched a study by Sereena in 2001 and Steptoe in 2007, which they said that they highlight the negative impact of factors like family income, parental education, and financial struggles on student mental health cause depression. Living arrangements with dissatisfaction with shared accommodation or a lack of social support lead to depression, says Harishah in 2014. The cognitive vulnerability transactional stress theory addresses gender differences in how cognitive vulnerability and social stress interact to contribute to the development of depression in adolescents.
Provides scientific evidence for educational institutions and policymakers to help develop, in fact, mental health support policies and invitations, promote the development and implementation of physiological counseling services, stress management courses, and social support programs, provides an important reference to research on how to improve the academic environment to promote students' mental health. There are several important findings and comprehensive and scientific research evidence regarding the development of effective mental health support policies and invitations measures in education institutions. Invitations measures for students' mental health and well-being. These invitations include mindfulness based on invitations, physiological invitations, physiological education invitations, entertainment programs, relaxation invitations development based on invitations and stress management. Research has shown that mindfulness based on invitations and invitations counted through techno means are actively when compared to passive control groups. Another study investigated the impact of peer sport on the mental health and happiness in higher education institutions. The purpose of the study is to better understand the aggregate peer sport in higher education institutions. The results show that peer-led sport groups, peer gardeners, and peer learning and peer gardeners reported more positive and scientific effects on anxiety and stress outcomes.
Lastly, let's look at the conclusion. Social connections play a critical role. If a student is struggling with depression, maybe their friends or family member can be a good support system. Due to social distancing measures, like for an example, as a university student, it's easy to feel isolated and disconnected from loved ones. This is an opportunity to get creative. Thank you.